PrEP is something you plan for. PEP is something you reach for when something unplanned has happened to you. And when you reach for it, time matters. Sounds confusing? Don't worry, I got you. Let's chat. PEP. Post-exposure prophylaxis is an ARV-based therapy taken by people who are not living with HIV after a potential HIV exposure. It works by stopping the HIV virus from replicating and attaching itself to your cell's DNA. But for it to work, it's important to get it as soon as possible and within a 72-hour window period. It comes in the form of a pill that you take every day for over the course of 28 days. And HIV testing happens at the start and at the end of that 28-day course. PEP has been around for decades in clinical settings, particularly for healthcare workers who may have been handling biological samples that may have HIV. And that's important, but the thing is, it's been kind of framed that PEP is for specific people, and it isn't. PEP is for anyone who feels that they are at risk of HIV transmission in their recent interactions. And one of the most important and least talked about uses of PEP is for survivors of sexual assault. The tool exists, but reaching it within that 72-hour window after a recent assault is such an enormous ask. And the thing is, each barrier has a timestamp on it. The emotional trauma of processing a recent assault, the clinic not having PEP, the stigma in the waiting room, a healthcare worker who isn't trauma informed, not having transport, not knowing your rights. I mean, each one of these barriers can make a really big difference. But knowing that PEP exists and knowing that it's yours to access is kind of a start. And one more thing. PEP needs a prescription, so you need to know where you can get it before you need it. That's public clinics, hospitals, emergency rooms are kind of your best bet and your starting point. Prevention isn't always clean or planned. Sometimes it's messy and sometimes it's urgent. But if you can take anything from this, is that PEP is yours. Know that it exists, know your rights, and if you need it, go get it. Next episode, we're going to be speaking about treatment as prevention, and it's another tool that's personal and powerful and really important to speak about. So stick around. Bye.